Before we begin the afternoon program, I want to introduce you to a project. Where's Aaron LaBelle? Aaron, stand up. Aaron's back here. Aaron is the photo coordinator of the Athens Photo Project and Co-op. You can see some of the work displayed, and before you leave, please go over and spend a little time admiring those photographs. What is the Athens Photo Project? Well, it's for individuals living with ongoing mental health challenges, people who deserve to be active and to have a voice in their communities. Now, traditional health care on its own cannot always ensure that all community members have the support they need to overcome the barriers of social isolation, feelings of low self-worth, and stigma associated with mental illness. We all know that. And now for nearly 2 decades, this Athens Project offers peer support, art education, public art exhibitions as resources to help community members rebuild meaningful and fulfilling lives through the arts. Through 30-week introductory and advanced level photography classes, think of that, 30-week long, our artists build skills, express their ideas, their feelings and perspectives, and contribute to the community as working artists. So I'm going to ask all the artists who are here participating in this project, please stand and let us recognize you. Thank you so much. Now, we're going to start the afternoon program, and I'm going to be introducing to you here in a moment someone from my hometown of Portsmouth, Ohio. Chief Robert Ware. He is the chief of police for the Portsmouth, Ohio Department. He served with me and others on the Recovery Council established by Governor DeWine. Chief Ware serves on the Gallia, Jackson, and Meigs Adam Board. And I want to tell you, he's a very strong voice in the criminal justice arena, especially as he speaks up in support of those with mental health and substance abuse issues. Chief Ware is one of my heroes. Chief, come and speak to us, please. God knows we need law enforcement officers who are sensitive to the needs of those who have mental illness and addiction problems.
Just one clarification. I'm on the Soda, Adams, and Lawrence County Adams Board. Jackson, you'll have to wait for me for a while. I never write down my remarks. I kind of go with the flow and get a feel for what the moment calls for. And yeah, I'm not a hero. When I was asked to serve on the Recovery Ohio Board, I looked around and there's a former governor and there's a former Supreme Court justice and there's all these remarkable people in the room. I was actually humbled that I was even asked to be a part of that. And then I'm sitting here today, and my punchline was going to be about the young lady that spoke before me until she spoke, and I heard her message. I was like, wow, I don't even know where to begin with that. But I will say, you're a remarkable young lady. What you described to us today is happening every day in our schools, in our youth, on our campuses, and it's normal. It's okay to talk about it, and you actually did talk about it, and what you can bring to today's youth, there's no stronger message than just being able to talk about it. So thank you. I was asked one day by our faith community, how can we help with this drug problem? And I said, help our youth. Because our youth are living, in some regards, a living hell because of the actions of their parents or the lack of care in regards to mental health. And I will tell you, and I had to clarify with Jane, and I don't see her now, but she made a remark about law enforcement not understanding violence or attaching a violent stigma to mental illness. And I wanted to make sure I understood what she was talking about before I came up here and spoke to you about mental illness. So I want to share a little bit of our conversation. Her meaning behind what she said about the stigma was that there are certain criminal justice professionals, law enforcement, judges, prosecutors, that would rather lock somebody up with a mental illness than take the chance that they're going to be a violent offender. That's not common across the state, but it is still there. That stigma still does exist, as does some stigmas as it relates to drug abuse. Here's what I surmise. When we look at these school shootings, when we look at workplace violence, when we look at suicide, drug addiction, alcoholism, pairing that back to self-medication, what we find, and it was said earlier that 1 in 4 or 5 Ohioans suffer with some kind of mental illness. I would submit to you, if we got serious about mental illness, we wouldn't have some of the problems we have right now, and we wouldn't have to even get into debates about whether it's appropriate to take guns from individuals or whether it's appropriate to take other criminal sanctions against people. Let's get to the root of the problem, give people resources, especially our adolescents who have to travel hours away to get any kind of service. Let's get to the root of the problem. If 1 in 5 people had high blood pressure, that high blood pressure would get treated. If 1 in 5 had heart disease, that heart disease would get treated. So why can't 1 in 5 get mental health treatment? Now, I understand we have some insurance folks here, and I can certainly say on behalf of everybody in this room, we're grateful for the support that you've given to this gathering today. But I will say that one of the things, if you have not read the Recovery Ohio recommendations, you should. There's 75 of them, and I will guarantee you that every comment that was made by an Athens board director today in the panel discussion had in that room of 30 individuals over 6 sessions dodging snowstorms to bring the governor's call to action to fruition. If we would fund behavioral health care on par with medical health care, we would recoup our savings in medical care. Because if you look at the life expectancy and the health factors of people with untreated mental illness, they have a younger life expectancy, they have much more health needs, it's more difficult for them to live healthy lifestyles when they have to struggle every day with a mental illness. We can fix this. If we treat mental illness and quit putting people in jails and in prisons, we recoup those cost savings by reducing the cost of housing offenders. Now, I'm not saying let's quit arresting offenders, but I will tell you from my own experience in Portsmouth, when I first started, there were 2 or 3 people walking the streets that suffered from mental illness, and we all knew it, and they weren't in the jails. If they got so severe that they needed acute care, we took them up the hill to our psychiatric hospital, the one we no longer have. So the one we do have in this region for acute care covers almost the entire Appalachian region. So when we need a bed for somebody that needs acute care, the forensic beds have taken all those beds. And when we don't, they're on the streets. They're becoming addicted, they're becoming homeless, or they commit a crime and wind up in our jails. There was a point in time where I would argue that our best mental health services were in our jails and prisons. But if we wait till they get to jail, we wait till they've committed a serious crime, we've wasted so many opportunities to intervene and allow them to get back on track. How hard is it to get on track, have a house, have a car, have a job, provide for a family, when no one's going to hire you because you have offended? Let's take care of the problems early. Jail is not a place for someone suffering from mental illness. Jail is a place for the people that are never, ever going to change their ways, the violent offenders. Let's take care of people at the earliest point of intervention, and then we won't have the crimes committed, the homelessness, the addiction, the alcoholism, the mass violence, the suicide. It all comes back down to making sure that we are mentally fit. Sometimes we need a little intervention. Sometimes if you have a chronic medical condition, you find out every once in a while it flares up. And what do? You go get it fixed. You go get treatment. You go get assistance. We need to do the same with mental illness. We need to make sure that there's local access to care, especially for adolescents. We need to make sure that we have solid flow of qualified practitioners in the field. And in Appalachia, I was brought up by one of the panelists. All of these conversations were had at the table and are within those 75 recommendations. Now, how do we get to those? It's going to take a little bit of discussion, and that's where you all come in. Governor Strickland and I are the Appalachian members of that 30-member committee. We have 4-year appointments, and we're going to continue to work with the government directors to ensure that we can bring those 75 recommendations to life. Now, what happens once somebody's stabilized, we get them through treatment, and they're back into the community? They've got to have a job. The governor, through Director Carey, asked me to serve on the Substance Use Committee for the Appalachian Regional Commission. And for those of you who don't really know what the Appalachian Regional Commission's established for, it's established particularly for the Appalachian counties and states to provide economic development initiatives and opportunities. They have money set aside to get people from recovery to work. And as we know with drug addiction, a lot of people going through treatment for substance use disorder also have that dual diagnosis of mental health. So if we can provide an avenue for people to get meaningful living wages in our region, we can lessen the chance that our next generation of children are going to grow up with poverty, lack of education, untreated mental illness, or vulnerable to substance abuse. So what I want to say to the people in this room is you have the most important job in the state of Ohio right now, and that is bringing attention to the needs of those who have mental illness or suffer in mental crisis at 3 o'clock in the morning and they don't have services available to them. You are the voice for the people that have to drive 3 hours to get care, or that don't have any place to go and wind up on the streets. So for the state directors in here, or people representing them, from a law enforcement voice, I can tell you the number one thing that is asked for from law enforcement leaders is mental health services. I serve as a district representative to the Ohio Association of Chiefs of Police, and that area covers from basically Athens County down through Adams County, and we're all served by one psychiatric hospital. We all have jails that are either overcrowded, on state mandated caps, or they're shipping prisoners out to other areas. We need those jail beds for the worst of the worst. We don't need to lock someone up who has an untreated mental illness and has become homeless or committed these low-level crimes as they try to survive. So from the law enforcement standpoint, we want to keep you safe, and that means helping those that need mental health services. So with that, I'll end. I just wanted to share with you the impact that untreated mental illness has on communities. And we worry about where we put our money and how much costs are, but if we get to the root cause of most of our social ills and our expenses, it is in that untreated mental illness. And if we can continue to advocate and affect change, we'll make all of our communities much more safer and much more enjoyable. So with that, if you have any questions, I'll stick around at the end of the day. Thank you.
Thank you, Chief Ware. Now, I was just sitting there reminiscing as I was listening to the chief. You know, if I was experiencing a mental health crisis personally, that's the kind of police officer I would like to have encounters with. Someone who understands, someone who is compassionate, someone who really cares and sees their responsibilities as not just apprehending those who are breaking the law, but trying to understand the circumstances that lead to some of those encounters. Well, we all know that in Ohio, suicide is a huge problem. We lose approximately 5 of our citizens every day to suicide. That means we lose nearly 500 Ohioans per year to suicide. We believe that suicide is something that demands our concern and our attention. And we have a person here today who's going to be speaking with us, who is the director of the Ohio Suicide Prevention Foundation, which is a subsidiary of NAMI, Ohio. His name is Toni Coder, and in his role, Toni will be coordinating a statewide effort to help local communities address suicide prevention. It's a big job, Toni, and we welcome you to come and speak to us about it.
Thank you so much, Governor Strickland. My name is Toni Coder, and I am the, I actually have to have notes, because if I don't have notes, then I usually either have to apologize a lot or get defunded. So I'll keep my notes. I am Toni Coder, and I'm the Executive Director of the Ohio Suicide Prevention Foundation, and I do want to thank NAMI for inviting me to this very, very important event. This is not a job I wanted to do. I did not want this job at all. It's not something I ever saw my career path as going. And actually, when I was offered this job, I turned it down. It was a big undertaking. It's not great dinner conversation, quite frankly. And anybody that knows Terry Russell wouldn't give up, though. So Terry kept coming at me, and I remember I talked to him on a Thursday and said, I don't know, Terry, and my son called me on Saturday, 2 days after Terry had offered me the position, and my son had a suicide attempt back in 2017 in December, and he said, so Dad, what'd you do about that job? And I said, it's a big undertaking. It's it's huge. It's, there's so much that has to be worked out. There's not a whole lot of funding behind it. It's just a big issue. And, he said, Dad, he said, can you go back to Terry and can you say I made a mistake? And I said, why would I do that? But he said, Dad, I want you to do it for me and kids like me. So that's why I'm here today. I'm here for my son. Suicide is a hard subject to discuss, and it's even harder for me to comprehend. I remember when I was a young kid, around 5 or 6 years old, I was in kindergarten at the time, there was a lady that my grandma knew that got the C word. She didn't mention it. She said, I got, so-and-so got the C word. She was from Virginia. So-and-so got the C word. And I remember in my young, tiny little brain that this happened because it impacted me so much. I didn't know what the C word was. I knew what the F word was because my mother said it all the time. I didn't know what the C word was. So I knew, though, that it must have been a terrible word, whatever this C word is. And I was told to say not to say things like curse words, so I naturally thought that the C word was a cuss word. If I spoke about it, somehow I'd get in trouble for it. And it was somehow supposed to be shameful. But I look today, and the largest run in Columbus that we have is all around the C word. Cancer. Breast cancer. This run raises millions of dollars and gets so many individual and corporate sponsors because we can talk freely about, and we can understand that the C word needs to be talked about. It needs to be shared with one another because of the awareness that it brings, and the simple act of talking about cancer helps us understand what we need to do. It reminds me that I need to make sure that my body's in line, that my wife gets a mammogram every year. That's what talking about the C word does, talking about cancer. It reminds us, we need to be okay. And I am grateful for the continued research and the funding that race raises, because my mother has survived cancer herself. So we can't hide words. We've got to get around this stigma. We got to start talking about suicide and not hide it behind closed doors. Here we are. Suicide is facing that same stigma that we had with cancer 30, 40 years ago. We are, as Governor Strickland said, losing nearly 5 people every day to suicide in Ohio, and suicide is the second leading cause of death for kids ages 14 to 18 in our state. Is this acceptable? Is this acceptable? It's also the leading cause of death for kids ages 10 to 14, which is unfathomable to me. I have a 10-year-old son myself. Second marriage. That's what a second marriage will do for you. That was a joke. That's the best it's going to get for the rest of the time. But the majority of our suicides, about 78% are men over the age of 40. And about half of those folks have visited their primary care physicians within a month of taking their own lives. They know that something is wrong. They know that something's going on, and the doctor, yeah, your blood pressure looks good, your heart, yeah, it's a little up, maybe I'll give you a little Lipitor, whatever that is. They know something's wrong, but they don't exactly know how to describe it. What is going on within their minds and within their souls? And here we are sitting in the very epicenter of suicide in the state of Ohio, Appalachia, Ohio. The Ohio Alliance for Innovation and Population Health, which is a study out of, or a group out of Ohio University, looked at suicide over the past 10 years, and as Robin said, the 3 highest suicide rates are right here in southeast Ohio, Meigs, Jackson, and Hocking County. And Appalachian, Ohio reported higher suicide rates per 100,000 population than the remainder of the state. It's right here. We're right at the center of it. Suicide statewide has risen 36% over the past decade. And this Ohio University report also stated that we have lost over 500,000 years of life over a decade. 500,000 years of life lost to suicide in this state. Yet, in my opinion, because of the stigma that surrounds this issue and the issue of mental illness as a whole, the federal government and the state legislature is, Jay Edwards here yet? I don't want to say anything, get me in trouble. I don't want to get defunded. Okay, thank you. So we're going there. The federal government and state legislature do not fund the issue as they do others. I'm hopeful that this is changing. I'm hopeful that Governor DeWine is because he is investing in mental health through his Recovery Ohio plan, and he's putting more money than any governor in the state of Ohio has ever done. He's making this a priority, and he's investing through schools, through communities, through local outreach. However, the burden still falls to local community groups and ADAM boards around the state. And as Sue from Scioto County said earlier, some of the Appalachian region of the state do not have levies and can only support suicide prevention through volunteer efforts. So I want to thank the ADAM board directors for what they do, because without those ADAM board directors organizing and being the hubs at the central locations, we'd be in a bigger mess than what we are right now. So I want to thank you for doing what you do. I want to thank you all for volunteering, because I know that a lot of folks volunteer on different suicide prevention coalitions and suicide efforts. You go to suicide prevention walks across your community, and I want to thank you for that. And I want to tell you that we at the Ohio Suicide Prevention Foundation are leading a group to create a state suicide prevention plan, because we're the only state in the country that does not have one currently. So we're doing that right now. NAMI's on it. I've got Veterans Group. We've got OMOS. Dr. Trevino is a member of that group. We've got boards. We've got a little bit of everybody to help build this plan so that we can have a direction and we can have some priorities around suicide prevention in this state. One of those priorities, there's 5 of them, one of those priorities is the Appalachian region. Helping folks right here, because we know if we do not attack suicide at the epicenter, then the state as a whole cannot be healthy. We recognize that as a state we need to do better, and we want to put an emphasis on the needs of Appalachian citizens to prevent suicide. You know, just yesterday, I was at a wedding on Saturday, and my aunt's she's a lunch lady. for a local school. And she told me about a young man who killed himself last Tuesday. 19 years old, just graduated in June, going to Ohio State in Lima. And I looked for his obit, and interestingly enough, his family was giving asking for donations to the foundation I run. So I went to his viewing. I went to his calling hours yesterday. And there must have been, in this tiny little town called Zanesfield, Ohio, not Zanesville, but Zanesfield, there must have been somewhere around 500 people or so there. And I remember sitting in this little church where they had the calling hours. And I've not, you hear these things about people being lost. I was caught up in my thoughts and I was lost. I've never seen that really until yesterday when I saw the mother of that young man. And I remember her looking at the people as they walked up, hugging them, and every time she would look over at her son and almost give a quizzical look. Like, why the hell am I here? This has got to be a nightmare. Somebody wake me up. And I watched as this guy was a football player, a big tough guy, and I watched as these enormous kids fell into the arms of this father. Sometimes the father barely being able to hold these kids up. And they'd go over to the mom and the sister, and they would hug them as well. And I watched young girls literally wail over the death of their friend and their classmate as recently as 3 months ago. And as I'm standing up here talking and we're having this conference, literally, they are laying Nicholas Paul Macon to rest. They're putting his body in the ground this morning. When I met his parents yesterday, as their son laid next to us, I gave my condolences to them, but honestly, I worried about what these kids are going to do. Are they going to have counselors? We talked about workforce issues. What's the school going to do today with these kids who are just distraught? What's going to happen to this mom and dad and little sister that he has? We need to do better, folks. We need to do better now. I'm going to end today with an email that I received on this past Thursday, from a mother who lost her 15-year-old daughter to suicide last November. And she never met the woman. She's emailed a few times, and I've talked to her on the phone once. But she sent me a simple link to a Facebook post that read, "Today would have been my Stella's 16th birthday. I miss her so much. I'm sure that in her depression and pain, she did not think about me having to spend the rest of her birthdays without her. Wishing I could still wake her up singing to her, wondering what she would have wanted for her birthday, imagining how much she would have changed, remembering all the fun times we had celebrating her birth. I just wish I could do it all again." If you are having thoughts of suicide, reach out to somebody. Don't be ashamed of this conversation. If you think someone is suicidal or struggling through life, reach out to them. You talk about Kevin Hines, and he jumped from the Golden Gate Bridge and was one of the few people who lived. And he says in his conversation, and he says in his talks, he said, if one person would have asked me how I was doing, I wouldn't have jumped that day. One person. You can be that one person. We need to be that one person and have those conversations. Suicide cannot be discussed only in private, and it cannot be ignored. We're losing people at an astonishingly increasing rate, And I'm urging you to be the advocates at all levels to have these conversations and improve systems to save lives. Your conversation, you reaching out, just might be that one that helps that person get through whatever it is they're going through. God bless you for all you do, and let's lead the discussion to prevent suicide in Appalachia and around Ohio. Thank you so much.